Sabin has a very unique mission. We're a small organization, but we do a lot. We have an R&D side of the house, but we also have a global immunization side of the house. And the reason we do both of those things is because that's what Dr. Sabin did. I don't think a lot of people really realize that Dr. Sabin, yes, he discovered the oral polio vaccine, but then he really left his laboratory and went out to the world and really wanted to make sure that every child, regardless of their race, their gender, their religion, their nationality, their socioeconomic status, had access to his vaccine.
We have a mission-driven focus rather than a financially driven focus. It's a really committed group of people who are trying to make that happen. That provides some degree of confidence to those that we work with, to those that we're trying to serve, and to those that might have questions about vaccines or the vaccination program that might be unrolling.
Right now, we're all living the COVID epidemic, and we see how the world has shrunk and generally suffering is rampant. And a vaccine can transform and is currently transforming that world.
Vaccines are so important to building health in the 21st century. They're the greatest preventive tool for those who suffer disproportionately in low and middle income countries, but they're only reach their full preventive and protective potential if they're equitably distributed across the globe and to everyone who needs them.
So what Sabin is able to do is to bring the science together with the funding that will allow us to make it cost effectively and get it delivered to the people that need it the most.
I've grown up in a developing country myself where people did not have access to vaccines or other health advisory or health services. The work that the Sabin Vaccine Institute is doing is not only intended to help people here in the United States but around the world.